though it is not all miscarriages that are preventable, but there are things you can do to optimize the outcome of your pregnancy and have a positive pregnancy outcome. Hello and welcome to Treasure Health Space. My name is Onyechi Linda. I'm a registered nurse midwife. If you are new to this channel, we talk about fertility related issues for women. And if this looks like the kind of content you will like, keep watching and don't forget to subscribe. So if you have had a miscarriage before, it is not your fault. Stop blaming yourself. And what is a miscarriage? Miscarriage is simply the loss of a pregnancy before 20 weeks gestation. A lot of people have miscarriages even before they notice that they are pregnant. How do you know that you've had a miscarriage? If you've had a miscarriage, you stop having the pregnancy symptoms you were having. If you were having morning sickness, throwing up, having nausea, breast tenderness, all of those symptoms are going to cease. Some signs of miscarriage include abdominal cramps, back pain, bleeding, or maybe you even be seeing clots. That could be a sign of miscarriage. Now, what are the causes of miscarriage? I'm going to list a number of causes. Maternal health has been implicated as one of the causes of miscarriages. Now, if you have a pre-existing medical condition, by pre-existing, I mean this condition has been there before you got pregnant. Conditions like diabetes, hypertension, thyroid disease, you need to take your medications correctly. If you're asked to take them twice a day, take them twice a day, not once a week. With that, you can increase your chances of having a positive pregnancy outcome. Also, if you have these pre-existing conditions and you notice you're pregnant, you need to see your healthcare provider to prescribe pregnancy-friendly medications for you, because some of the medication you might be on might not be pregnancy friendly. The next cause of miscarriage is uterine fibroids. These are benign growths on the uterus. Now, depending on their size and location, they can cause miscarriages. Another cause of miscarriage is weight gain, excessive weight gain. You need to maintain a healthy weight. That will increase your chances of optimizing your pregnancy. Smoking and alcohol consumption can also increase your chances of having miscarriages. Smoking, whether you are an active smoker or a second-hand smoker. Second-hand smoker, I mean you are always around people that smoke. You're not the one smoking. That is, you're passively smoking or inhaling those substances. Now, it will increase your chances of having a miscarriage. Also, taking medications that are not prescribed can increase your chances of having miscarriages. Medications like retinoids, both the topical and oral form of it, misoprostol, some strong pain reliefs can increase your chances of having a miscarriage. Another significant cause of miscarriage is cervical insufficiency. Now, the cervix is the neck of the uterus, the lower part that opens up for the baby to come out. Now, if it is not well closed, it can lead to recurrent miscarriages. And the baba of them all is chromosomal abnormalities. Now, these chromosomes make up the DNA responsible for one's genetic makeup. So once there is any fault in the chromosomal makeup, most times it will lead to a miscarriage. To prevent miscarriage, you need to start your antenatal early enough. Antenatal helps for early detection and early intervention. Now, you'll be told the do's and don'ts of pregnancy. This is because each pregnancy is unique and might need a different approach or intervention in managing it for you to get a positive outcome. Also, antenatal care helps for early detection and early intervention for conditions like gestational diabetes, hypertension in pregnancy, or even low progesterone level. All these things will be detected and corrected early if you start your antenatal care early enough. Another thing for you to do is to start taking your prenatal vitamins and make sure that it contains folic acid, vitamin D, zinc, and all other necessary components that needs to be there. And this folic acid mainly helps to prevent neural tube defects. Another thing you can do to prevent miscarriages is to treat infections promptly and properly. You need to treat them early. You need to complete your dose of drugs. You need to complete the dosage. If you already have a pre-existing medical condition, make sure you are taking your medications correctly. If you have diabetes and you're taking your medications correctly, your blood sugar is going to be in check. Also, avoid heavy weight lifting and rigorous exercise. While moderate exercise can be good for health, when it becomes rigorous and intense, it can increase your chances of having a miscarriage. If you have been having recurrent miscarriages, it's important that you practice safe sex. You need to follow your provider's instruction on this one. Sometimes it's best to avoid the sex ultimately, but make sure you're practicing safe sex. So there are investigations you can do to find out if a child or a baby have chromosomal abnormality, like the chorionic villus sampling that is done between 10 to 14 weeks by collecting a sample of the placenta. Amniocentesis can also be done at 16 to 18 weeks using a sample of the amniotic fluid. Also, pre-implantation genetic testing is done in case of IVF. If the child has a chromosomal abnormality, then there won't be an embryo transfer. Okay, so doing all this will increase your chances of having a positive pregnancy outcome. So if you got value from this video, if you found this video informative, like this video, share with your friends, subscribe to my channel, and turn on your notifications so you don't miss any of my videos. Bye, and see you in my next video.